it's been realized many decades ago that testosterone play a role in causing the prostate to enlarge, and in some cases, the cancer cells in the prostate go a bit haywire. So for men who's got high testosterone, the actual amount of testosterone can cause the cells to continue to grow in prostate cancer patients. So many decades ago, we realized that by castrating, yes, cutting the balls off, you will suppress the testosterone immediately, and even a man who suffers from stage 4 prostate cancer that is spread to the bones, the cancer is temporarily suppressed and remain dormant. And that's a very interesting way of handling cancer. It's called hormonal manipulation. Of course, in the 21st century, 2021, we don't chop off your balls anymore. There are medicines available. These medicines are called LHRH agonists. Basically, it's similar to the ones that's produced in the brain and trick the testicle to suppress the production of testosterone. We call it chemical castration. I know it sounds awful, but chemical castration just means injection directly into the fatty area of the tummy and will suppress the testosterone effectively. And it can range from injection for 1 month, 3 months, or 6 months. And for prostate cancer patients, it really will be effective for a long duration of time. So for those patients, the chemical castration is lifelong. But for another group of patients who undergo radiotherapy, this castration is very temporarily. It can range from 2 to 3 years. The whole purpose is that with suppression of testosterone, it will shrink the prostate, enhance the efficacy of radiotherapy, and therefore light at the end of the tunnel. So for the reader who wrote to me, sadly had the diagnosis of prostate cancer, is undergoing the treatment for radiotherapy and also hormonal manipulation at the same time. Obviously, the chemical castration is making him undergoing menopause, a real menopause, and at the same time, he's worried about his sex life, libido, and erection. He's wondering whether it is possible to stop the treatment so that can revive the sexual activities. We know that during this period of time, you have to tough it out a little bit with the hormonal suppression. There is a light at the end of the tunnel because this suppression is temporarily. And for most men, the testicular function will return after stoppage of the injections. So therefore, we understand a lot more about correlations between testosterone and also prostate cancer, and there's a small price to pay in order to either suppress the cancer or cure you from the trauma and the curse of this cancer. Okay, so for the month of June, what are we going to talk about? We're going to talk about ejaculations. Yes, there are many things to talk about ejaculation for the whole month, ranging from reproductive, so how much of ejaculation is necessary in order to conceive, or sexual dysfunction such as premature ejaculation. So if that interests you, if you or your friend suffers from premature ejaculation, you know what to do. Stay tuned for next week's Putting Dr. G on the Spot.